Okay, I believe we have to start. It's already 2 o'clock Bishkek time, 10 a.m. Rome time, time to go. Good morning, good afternoon, ladies and gentlemen. Welcome to the Life in Kyrgyzstan conference, the session on the impact of COVID on rural women and men in 3 countries of Central Asia, Kyrgyzstan, Kazakhstan, and Kyrgyzstan, Tajikistan, and Uzbekistan. First, let me give the floor to Ms. Yassin Kaaria, who is head of the project from the FAO side. Please.
Thank you very much, Roman. Good morning, good afternoon, everyone. It's a pleasure for me to be here. As Roman has said, my name is Yassin Kaaria. I'm Senior Gender Officer and Team Leader for Gender in FAO, the Food and Agriculture Organization of the United Nations. So let me give you a little bit of a quick background about why this project and why we thought it was a worthy investment for us. So right at the beginning of COVID-19, around April, FAO very quickly realized that we needed to start to think about how we could support governments in developing responses to the pandemic and to the impacts of the pandemic. And so we started to prepare what were policy briefs, and almost every unit within FAO prepared one. So we from the gender team also prepared a policy brief that looked at the gendered impacts of COVID-19. And at the time, we could only look at the past, where there had been other past pandemics. So that's like Ebola, for example, and that's what we used. And we estimated or really hypothesized that there would be impacts in several places, that there would be impacts. There would be reduced economic opportunities, that there would be worsening nutritional status. We also thought that there would be increase in women's work burden, and also gender-based violence, because this is what had been seen in previous pandemics such as Ebola. But what was really important was we also predicted that rural women were going to be disproportionately affected compared to men. And the reason was that the gender inequalities that shaped the lives of rural women prior to the pandemic were going to lead to women suffering more, because they have less access to technologies, to services, to opportunities, to information. And so as the pandemic has actually continued, we have now begun to see that some of these that we predicted or we proposed have happened. So what have we seen in terms of reduced economic opportunities for rural women? We have found everywhere we've looked with the evidence that COVID-19 restrictions have posed a serious threat to the livelihoods of poor rural women, because they were unable to engage in as farmers, as processors, as traders because of the lockdowns. We also saw that COVID-19 was pushing millions more women into extreme poverty. We have found that there has been worsened access to nutritious, safe food for women and girls. And this, of course, is because women's own food security and nutrition needs, and often those of girls, can be neglected at the household level because of discriminatory gender norms. And the state of the 2021 State of Food Security and Nutrition report finds this the case. And looking at it globally, the report says that the gender gap in food insecurity has grew even larger in 2020 as a result of the COVID pandemic. And it was in 2020, it became 10 percentage points compared to 6 percentage points in 2019. We've also seen there's been increased barriers for women in terms of accessing information, information around the COVID, information about where the services are. And of course, as we expected, this is because of their lower education, the lack of cell phones, lack of internet. So we found even in many places, women who have been surveyed did not receive the information about the pandemic, about the vaccines, etc. Of course, we also found, and this is very well documented now, the increased unpaid care work and an equal division of labor within the households due to the closures of schools, closure of public spaces, but also of care services. In fact, many of the studies show that many women have been expected to work longer hours, juggling domestic responsibilities as well as their productive work. And the school closures have really fallen disproportionately, have had a disproportionate impact on women who are responsible for taking care of these out of school children. And of course, there's been lots of evidence around gender-based violence. Actually, a big focus has been on that. And this is, of course, because of the restricted movement, the social isolation, economic insecurity, causing increasing tensions and putting women at risk. So looking at all this, we have lots of global evidence, but we believe that going forward, it really is going to be very important to ensure availability of sex and age disaggregated data and analysis for monitoring the gender-related impacts. And this will be extremely crucial in helping to tailor socially relevant and inclusive responses, and gender-responsive responses, actually. So we established this collaboration with the University of Central Asia to look at Central Asia and to look at how, what were the gendered impacts of COVID-19 on rural women and men. But it's not the only study we are doing. We also established collaboration with the International Food Policy Research Institute, and they are conducting a study in Africa. And we are also collaborating with Care International to look at the gendered impacts of COVID-19 in Northern Africa and the Near East. So what we believe is that this kind of analysis is going to be really crucial to provide us very targeted, very punctual recommendations on what is the best way forward for different players. And we're very excited. UCA's the objectives of the studies that we commissioned are related. We want to understand, first of all, the levels and the nature of the impacts on food security and nutrition, economic empowerment, access to resources, services. We want to look at impacts on rural women's and men's paid and unpaid workloads. We want to look at also women's own ability to respond and their capabilities to respond. And then a lot of responses were related to social protection, but we realized very quickly that social protection also needs to be responsive and reaching women. So again, part of the agreement is to identify to what extent the social protection mechanisms have really reached women. And finally, just to identify key priorities for future program response and that can support the design of gender responsive policies and measures in the COVID response. I don't want to say anymore. I think we are very excited and looking forward to hearing some of the key findings. Over to you, Roman.
Many thanks, Susan. Let me just provide a very brief overview of the session. And then, with your permission, I will immediately proceed with the first presentation. So the first presenter should be my colleague, Madina Junussova, who is Senior Research Fellow at our institute. But she has very serious and very positive reasons not to be here today with us. So unfortunately, she's not available. So I will do this presentation on behalf of her and the entire team. I will talk about key study findings, except one important area, which will be covered in the second presentation, which is going to be done by our FAO colleagues and key team members, Erdgin and Firas Yassin, who will talk about presentation of food insecurity methodology, measurement methodology, and the results of the food security analysis and gender gap in 3 countries of the region. Then another colleague from FAO, Kangasniemi, will tell us about findings from rapid assessment and microsimulation of impact of Cash Plus pilot study in Kyrgyzstan and Armenia. Very interesting. I remember we had preliminary results of that study in the previous conference. So happy to have now follow up and kind of more systematic analysis of results. And last but not the least, our colleague from the Gahan Foundation, Ms. Gulnora Mukhamadieva, will tell us about yet another study findings from rapid gender assessment on the impact of COVID-19 on women and girls in Tajikistan and Kyrgyzstan. So quite a bit of coverage with our study. Each presentation might take from 15 to 20 minutes max. And then at the end, we will have time for questions and answers. Thank you. So Susan, if you allow me, I will proceed immediately to the presentation. Let me share my screen. Is it seen now? It's coming probably.
Yes, very clear.
Excellent, thank you very much. So as you see, the title of our paper is Gender Impacts of COVID-19 on Agriculture, Food Security and Nutrition in Kyrgyzstan, Tajikistan and Uzbekistan. And as Susan already highlighted, and let me make it very clear from the very beginning, well, we focus not so much on agriculture, food security and nutrition per se, but rather how they affected women compared to men in our three countries. So the objectives of the study are to assess the impact of COVID on food security, nutrition, and freedom of violence across the access to resources, services, and information for rural women and men. To assess the impact of COVID-19 on rural women and men's paid and unpaid workloads, because we know that was something affected strongly. Analyze capacities and needs of women and men to respond to the crisis. And analyze the extent to which national social protection interventions have benefited rural women, having them been forgotten in the process of responding to this very serious, actually unprecedented crisis. So a couple of words on study design, methods, and data. The paper consists, the study consists of three components, which are shown in the graph in the middle. We had phone survey of rural respondents, 1,000 respondents in each country, 500 women, 500 men. That was based on the currently standard way of surveying, the computer-assisted telephone interviews. In addition to that, we had key informant interviews with such people as representatives of national governments, of local governments, civil society organizations, and of course, rural women in all countries. So altogether 60 interviews in 3 countries, 20 per country. And we had a desk study looking at what other people wrote by the moment we were preparing our study and what are the legislative responses, policy responses in general. So the study includes all these 3 components, and I'm going to report on findings of all 3. This slide is going to provide general information on how COVID, when it impacted the country, how it is impacted. I would like to attract your attention to the numbers in the top row of the table. So in Kyrgyzstan, according to available data by yesterday, 180,000 cases were registered and more than 2,600 deaths reported. In Tajikistan, the country which has more population than Kyrgyzstan, just 17,500 cases, so 10 times less, were registered, and again, probably 20 times less deaths reported. Uzbekistan, which has population roughly 5 times higher than Kyrgyzstan, the number of reported cases and deaths is roughly the same as in Kyrgyzstan. Well, that provides an useful insight into other data I'm going to report in the following slides. Apparently, the situation in Kyrgyzstan is much more open. The data are much more open. People are prepared to talk about their issues more than people in other countries. So don't be surprised with some cross-country differences. That's partially because of real situation and partially because of different attitude of respondents to the same questions. And it is important to stress that the questions asked in all three countries were absolutely the same. Same questionnaire was administered. But well, talking about the impact, so it was pretty serious, that's one thing. Secondly, it started mostly in March 2020. And then by the fall, winter 2020, the measures, the different types of acute period of lockdown was in March, from March to May 2020. After that, it was gradually eased, and after 2020, basically in 2021, almost no serious measures are being taken in all these three countries, which is quite a difference from some other parts of the world. So what we found in terms of impact on agriculture, well, first of all, expectedly, much more males than females engaged in agriculture in all three countries. So that's mostly male activity. Rural women have fewer opportunities to inherit and own agricultural lands. That's also something known, but our respondents strongly support, confirmed that information which we had from the past, from the distant past, actually. Also, in terms of decision-making in farming, you can see from the tables that it is much more frequently, it is male activity rather than females, or just well, from 10 to at best 24% of women participate in make decisions on farming and selling of agricultural products compared to 30, 40, almost 50% for men. If we look now at the responses of respondents regarding changes in agricultural production, you can see that the gender difference is not dramatic. It's basically men and women mostly selected same responses more frequently, which reflects their more or less similar understanding what are the issues in agricultural production. Even if females are less engaged, they have same understanding of the issues as males, which is, I would say, normal. So what they mentioned inability to access sales markets, closure of markets. That was, in particular in Kyrgyzstan, it was a very big issue in March, April, May 2020. And then next, second one is a big one also, is inability to access essential production resources, such as fodder, fertilizers. Let me add capital. Well, they usually borrowed, and it was more difficult this time. I think most of those complications relate to the strict lockdown period. So it was spring last year. Later on, almost all of these complications were gradually phased out. If you look at the non-agricultural activity and labor migration, which is a very prominent way of non-agricultural activity in all three countries, that's of course more male activities than female activity. Despite of all the challenges related to the pandemic, difficulties for people to move between countries, and we know most migrants from our part of the world, they go to Russia, and the communication with Russia was very, very difficult. Still, the migrants demonstrated impressive resilience and kept sending remittances home, maintaining livelihoods of their households, and proving that they are kind of really reliable source of revenue for their households. Migration is predominantly male activity. In Uzbekistan, number of male migrants is 7 times higher than than females, 10 times difference in Tajikistan, and notably 2 times difference in Kyrgyzstan. So in Kyrgyzstan, women migrate more frequently than in other 2 countries. If we talk about non-agricultural activities at home, then you will probably see that it is pretty much Same percentage of men and women in all three countries benefit from those other sources of money, basically such occupations as teachers, doctors, administration workers, and similar things. So up to 15% in Kyrgyzstan, up to 8% in Tajikistan, and just 3% of men and women in Uzbekistan reporting having significant, receiving significant resources from those non-agricultural activities. Well, again, that's our respondents, not necessarily reflect like situation in general population of these countries. Changes related to non-agricultural activities are different, and you can see that many people in Tajikistan and females in Uzbekistan, most frequent answer was they were not affected. And perhaps they could not be affected indeed, because, well, teachers continue working as teachers, even in the pandemic period. However, in Kyrgyzstan and for males in Uzbekistan, that's much less frequent answer. So effects was basically felt on everywhere, and especially shortage of consumers, of customers. So fewer people were interested in receiving just because of fewer, like, for example, in Kyrgyzstan, tourism is a very important activity. Many rural people in summer season serve tourists. Of course, in COVID times, tourism went to almost zero and people lost a lot of their clients. That is just an example. Another is what we already mentioned with regards to agriculture, also related to non-agricultural activities, the ability to access sales markets. Something which might be a big issue in other places was not very big issue in our part of the world, except perhaps Kyrgyzstan, the inability to switch to online format. So there was no such, basically there is no such issue in Tajikistan and Uzbekistan, and Kyrgyzstan, roughly a quarter of all respondents mentions that. If we look now on the impact on income loss and access to finance, first of all, most people, both women and men, mention that they prefer, if they have some savings, they prefer keep them as cash. So to keep them as assets like a livestock, for example, rather than have them as cash or bank deposit. That's perhaps a traditional way of doing savings, but might not be very helpful in this particular crisis when cash was very important. But many of people don't have savings, so it was really a harsh situation for them because many of them suffered income losses. So many people had to sell their assets or borrow money from friends, relatives, or formal lenders. And of course, we have very clear gender divide in these regards. So male family members are supposed to be, in reality, are primary breadwinners, and so they had, because of general shock on incomes, they had high income losses. But rural women, on the other side, they remain dependent on the decisions of their male family members. So really, they maybe have less income, so less chances to lose it. And men also reported using personal savings more frequently than women, and you see the numbers on the slide. Well, basically, very interesting country variation with much fewer people reporting using personal savings in Uzbekistan. People reported the following data on the impact on access to services and work burden mostly in household. So you see that women, especially women, reported significant percentage of cases when they had limited access to health services, up to more than 1/3 in Kyrgyzstan, for example. Also, many households, again, similar numbers for both genders, they reported that their pregnant and breastfeeding family members had lacked access to health services, which is kind of unpleasant news, but unfortunately, well-known reality. So, of course, because traditionally rural women take care of all the household activities, they also suffered the increased workload related to this during the pandemic, when all household members were at home, had no other choice, especially kids who couldn't attend schools and had to take online education, whatever quality. So it was even more burden for women to take care of not only usual things, but also about kids' education. So you can see here what people reported about time spent on household work, and basically on majority of types, people reported, quite significant majority of people reported that yes, they spent more time doing these or other things. For example, taking care of children, that's particularly, look, just 73% of Tajik women are reporting that, versus just 65% of men. Men also spent quite a bit, but less than women in all cases, basically. Then helping children with education, cleaning, and whatever other activities, they were quite time-consuming, more time-consuming during COVID times. If you look at the impact of COVID pandemic on decision-making and family relations, this was already based not so much on survey, but rather than on key informant interviews due to sensitivity of the topic. Well, of course, we learned some quite clear gender differences here. Male members are primary decision makers. They are women couldn't decide without them, and often parents or eldest family members also intervene into decision making inside the families. For rural women, this was an additional stress and sometimes aggression from other family members. So that's global finding was unfortunately fully confirmed in the context of our three countries. Rural families tried to resolve their conflicts through intervention of eldest family member, or just husband made a decision, whether or not wife is agreeing with that or not. Well, that's a reality. And sometimes they also, there is kind of attempt to talk to each other. And the rural women rarely use the services of shelters and or informing police or even parents, so they are really feel vulnerable in these situations. So we have some data on issues leading to family disagreement or tensions, and you can see that's all usual suspects: restrictions on movement, income, shortage of income, spending of resources, etc., etc. Also, quite a few different sources of disagreements in families. So let me just address very quickly the recommendations we formulated based on our findings. That's a very kind of quick snapshot of what we found. First, and perhaps one of the strongest recommendations, is to strengthen and expand social protection programs for rural women, especially from migrant households where they are most vulnerable. Organize mobile medical assistance teams working in rural areas, perhaps staffed by local people, properly trained. Change land use regulations and develop implementation mechanism to ensure that women have equal access to land in your rights. And establish new and support existing shelters or centers of support for victims of domestic violence, in particular in rural areas, because in urban areas we have something, in rural areas very, very little, if nothing. Then for local authorities is perhaps to organize and coordinate preventive and social protection measures with local communities to make sure that the people are well informed about this initiative. And also those who provide aid, they also need to understand who is in the most needy, because the experience showed that it was very often done in blind manner, and really not very often people in real need were missed with this assistance. And similarly provide support mechanism for victims of domestic violence, and then support the decision-making with data to which they are much closer. Civil society organizations are invited to to disseminate more gender-sensitive data on vulnerable categories, starting with women and especially young women, and provide joint training for spouses, men and women, for many reasons, to ensure that they receive same information, and so they are empowered to the same extent, and also they are prepared to share responsibilities, conduct activities together, and all of that, and also keep campaigning about women's rights. Finally, for international development organizations, is basically a recommendation is to support all these activities of local stakeholders in cases when the resources are not available, which is very often the case. Thank you very much.
Thank you. Thank you very much, Roman, for sharing with us that excellent presentation. Over to you again. Are you going to invite the next speaker, or shall I do that?
Yes, please.
Okay. So thank you very much. That was very, very interesting and also important for us to see the differences across countries. I thought that was quite marked information. So our next speakers are Erdgin Mane and Firas Yassin. They're both from FAO, and they're going to talk to us about the methodology that's called the FIES, the Food Insecurity Experience Scale methodology, and the results of the food security analysis, and looking at the gender gap in terms of food insecurity. Over to you, Erdgin and Firas.
Thanks a lot, Susan and Roman, for your introduction and for the invitation to this excellent conference. So I will share immediately my screen. Can you see my presentation?
Yes. No. Maybe.
It takes some time. Can you see now?
Yes.
Okay.
No, it was seen, but now you don't. That's your title slide.
Okay.
Yeah,
No. I think there is, because of the banner that you provided to us as the first page of my presentation. So today we'll be talking about food security, gender, and the impacts of COVID-19, as you already mentioned. So I took the opportunity to present more in depth the FIES methodology. So I invited my colleague Firas Yassin from the Statistics Division of FAO. He is in charge for the region here, and he also provides training to the national statistical offices in Uzbekistan, Tajikistan, and in Central Asian countries. So I will start immediately. So the outline of my presentation, first we'll talk about the definition of food security, so measuring food security from people experience. Then we'll present what the FIES survey model that we adopted in our survey with UCA. We'll talk about benefits of using FIES to measure food insecurity. Then, given that we are at university, so we will also go more in depth in terms of the RUSH model, which is the basis for the estimation based on the item response theory. Then we'll discuss a bit some statistical validation. We'll also present what are the official SDG indicators 2.1.1 and 2.1.2 in SOFI 2021, which is the state of food insecurity in the world. And these are the official figures that FAO, WHO, UNICEF, IFAD, and World Program publish every year. We'll talk the results of our survey in terms of gender gap and food security, what has been the impact of COVID-19, and conclusions and its implication. So I'll give you the floor to my colleague Firas Yassin to present the FIES methodology.
Thank you, Erdgin. Good morning and good afternoon, all. I will go directly because we have limited time. So I will be talking about the tool that Erdgin and the team used in this study. So the tool is the Food Insecurity Experience Scale that FAO developed in order to measure the food insecurity level at the global level. But when the pandemic arrived to us, of course, we had to respond quickly, and we could do some innovation to measure also the recent food insecurity in the case of a crisis like the spread of the pandemic, of course, changing the period, the reference period of the question. So the food insecurity experience scale is not invented by FAO, but it was developed based on other modules, food insecurity models that were already in the world, especially in North America and the United States and in South America as well. So it started the story of the experience-based food security tools started at Cornell University, where the researcher wanted to measure the food insecurity, asking or interviewing women, asking them about their experience in experiencing food insecurity and hunger. The women revealed a certain main food like dimension of food insecurity, like being worried about not having food, then being comprising on the quality and the variety of food, and then reducing maybe the quantity of food, and at the extreme level experiencing hunger. Of course, later on, the researcher replicated these interviews with women in other countries, and especially in the Latin American countries, and they concluded that these experiences are common across countries and cultures. Of course, this experiencing of food insecurity would have consequences on the physical, mental, and social well-being of people. Next slide, please. Then now we'll talk about the food insecurity experience scale that advised by FAO. We have two frames, one for individual and one for household. The questions or the module composed of 80 questions with simple answer yes, no, for each question. Of course, the respondents would be asked about a reference period of 12 months. This is for SDG, for the global monitoring. But for measuring recent food insecurity, the reference period is 1 month or 30 days. And this is what was used in this research. Of course, there's a condition for the 80 question, of course, to be conditioned on lack of money and other resources. Money is known, but other resources could be any other kind of accessing food, like the own production or an animal that prepared to be slaughtered and use its meat, or fishing or hunting, or even gathering from a forest or from the surrounding, in addition to the gift and the social assistance from the small society or from non-governmental organization. Of course, but there's another condition that shouldn't be for religious reason while people fasting, and shouldn't be for health reason when, for example, doctor asks the person to reduce food quantities for a health reason. Next slide. So this is the FIES module. Of course, I put the individual frame because it is used in this study and because it allows for the distinguishing between the male and female. So this is important to use the individual. Of course, as I said, the introduction is during the last, I would say 30 days here. Was there a time when, because of lack of money and other resources, then we have the 8, of course, the 8 common experiences that were found in the whole world. So, and these experiences started from the less severe to the more severe one. Of course, for the purpose of studying the impact of COVID-19, we added a follow-up question for each FIES question. We didn't add all of them here because there's no space on the page for all. So for each FIES question, we have follow-up. Was this specifically linked to COVID-19? So now we talk about these experiences. The first, or the less severe one, is being worried about not having enough food to eat. The second, you were unable to eat healthy and nutritious food. then you ate only few kinds of food. Up to now, we are talking about reducing the quality, like the quality and variety of food. But from question number 4, you had to skip a meal. Then we are talking about reducing the quantity of food. Then you ate less than you thought you should. This, I mean, you might not have skipped a meal, but in general, you ate less than you thought you should have eaten. And number 6, your household ran out of food. This means in a moment, you didn't find anything in your refrigerator in your house to eat. And then question number 7, you were hungry but didn't eat. The hungry here means the physical sentiment of the pain in the stomach. So you felt really hungry. So this is what we mean by hungry in this question. And the most severe experience is you went without eating for a whole day. This means 24 hours, of course, a whole day without eating anything. And this found to be the most severe experience by all people who were interviewed. Next slide, please. I'm going fast because I know we have limited time. What are the advantages of using FIES for measuring food insecurity? First, it is direct, asking people about their experience in food insecurity. Of course, it has a lot of advantage over collecting quantities of food or asking people to recall what they have eaten during the last 2 weeks and with food items and quantities. This is very easy. Then it is easy for also administering for the enumerators. It would take 5 minutes maximum. It has low cost to be added to any survey because, as you've seen, it is a very short module. Then it is statistically sound. The most important thing that it is comparable across countries. So you can have the scale in one country, and we have the equating process that we compare this scale in this country with the rest of the world. Then it distinguishes between severity level. We have moderates food insecurity and also severe food security as a result of analyzing FIES data. And at the end, the result can be disaggregated, of course, especially when we use the individual frame, of course, for location, for gender, and for other disaggregation levels. Please, next. The methodology used to analyze the FIES data is RASH model. And I mean, it is not the technical session, but I just give an idea about RASH model. So the essence of RASH model says that the probability of answering yes to a question is a function of the difference of the distance between the respondent's position and the item I mean the experience or the question, and the item position on the same severity scale. So we put the respondent and the item on the same scale, and then the probability of answering yes depends on the difference between their position. And of course, it is a logistic function, as you can see at the end of the formula. Of course, applying this RASH model using conditional maximum likelihood estimation would allow us to estimate the parameters, the severity parameters associated with each item, I mean by item with each question or experience, and with each respondent. I mean by respondent raw score. So if a respondent answers yes to 3 questions, so he is raw score 3. If answers 8 questions yes, so he is raw score 8. So this methodology allows us to produce parameters, severity parameter for each item and for each respondent. And then it also allows for statistical testing the data, the quality of the data. Next, please. So now I just give an idea about this statistical test that is, of course, a product of running the RASH model. So we have 4 main statistical tests. Entity statistic that detect if an item, always item is a question, doesn't work properly in this culture or in this country. When its value is more than 1.3, then we need to exclude the item from the analysis and redo the analysis again without the item. first. Second, we need to go again to the questions and maybe do again the language adaptation. The wording of the question could be not properly, translated from the original language, and maybe the enumerator don't understand well or cannot convey the meaning of the question to the respondent. So this is what is important. Outfit is similar to infit, but it is sensitive to few cases. Then we have residual correlation between items. When its value more than 0.4 in absolute terms, this means that the two items are overlapping in meaning. And then again, we need to go again to the question and check the wordings of each question. They might be overlapping. But at the long term, after applying the survey several times in the country, if they still overlapping, this means one of the question is not relevant in this society. And then later we have the rational reliability, which is the proportion of variability in the data that explained by the model. Last, I want to tell that all these outputs of the analysis can be done using RM weight package, which is a package in R that just we organize the data as 1, 0, we recode the data. 1 yes and 0 no, and in A for no response. And we use RM weight, and then all these the parameters for severity and the statistical test will be produced automatically by just running the model. I'll stop here and give the floor again to Erdgin to continue his presentation. Thank you.
Thank you, Firas, for your presentation. So, before going into the numbers of our survey, I think it was important also to present what are the official estimates in the 3 countries that FAO publishes every year. FAO, this is SOFI is a flagship publication of FAO, published every year, as I mentioned. But in the last few years, this is a joint publication with World Food Programme, IFAD, UNICEF and WHO. So it is important to mention here that the latest estimates show that I'm including here the 3 indicators of interest of food security. The first one is the historical indicator of FAO, is called prevalence of undernourishment. Then we have the indicator that we will talk here, 2.1.2, the prevalence of moderate or severe food insecurity, and then the prevalence of severe food insecurity. So overall in Central Asia, we have like the prevalence of undernourishment 3.2%, 15% the second indicator, and 3% the severe food insecurity. As you see, the POU, the prevalence of undernourishment, and the severe sort of correspond to each other, are closer to each other. So you can see the numbers here in Kyrgyzstan. So I'll focus on the indicator that we will present later. It's about 7% the probability of being food secure, and then it's 1.1% prevalence of food insecurity. Uzbekistan, it's much higher. It's 19.7% the moderate or severe, and 4% the severe, below 2.5. The prevalence of undernourishment, while we don't have official estimates for Tajikistan. This could be because generally these surveys are collected here by the Gulf World Poll, and it could that the country may not acknowledge, that sort of may not be official by the country. So going back to our survey conducted this year. So as Roman mentioned in his presentation, so the target population is rural people engaged in small farming activities in Kyrgyzstan, Tajikistan, and Uzbekistan. The sample size is 1,000 per country, 500 males and 500 females. And the survey was conducted in Kati in April and May 2021. So the areas were selected based on 4 criteria: the practice of small farming, dependence on income coming from labor migration, the COVID impact, and the gender-specific issues. So the first, let's say, a caution that we need to mention here, because as you see, the target population is not the full country. So the results of our survey cannot be analyzed to the whole country, but only to the areas that we have been covering, to the rural areas. And also there is another point that, of course, because of COVID, we were not able to go to interview in person the household, so we had to do this through telephone interviews. And as you know, the telephone interviews may be biased because they target only those households or individuals in rural areas that have telephones, no? And it could be that the extreme poor and the poor may not have access to telephones. So I'll go straight into the data. So this is the estimates by sex of severe, moderate, or severe food insecurity. So as you can see, in all the three countries, the prevalence of food insecurity for women is higher than men, and while the difference is larger, as you can see in Tajikistan. In the next slide, you can also see the real numbers. So there is about a difference of 7 percentage points in Uzbekistan, of 14 percentage points in Tajikistan, and there is a difference of about 8 percentage points in Kyrgyzstan. So in all of them, women, as I said, are more food insecure. While if you consider the severe food insecurity, which is a more extreme condition of experience of food insecurity, so women are always more food insecure, but the results are statistically significant only for in Tajikistan, and these results are significant, and you can also see the margins of error for each indicator. So now we also present the results of the impact on food security based on the questions that Firas mentioned earlier on the follow-up question on if a certain experience of food insecurity was due to COVID. This is a yes/no question. So you will see here that overall for both men and women, the results are quite high. So in all, and particularly for example, they are higher in Kyrgyzstan. So we have 80% of women and more than 70% of men that report that their experience of food insecurity was due to COVID. So this does not mean that 80% or 75% of people in the country, so you can see here the national level, the 73% of the people in the country are food insecure. This means that they may still be food secure, but because food security is a continuum. No? So, but we use thresholds not to define if a household is food insecure or not. They may still be food secure, but still they declare that their food security has been affected, even if they are still classified as food secure. And again, here you can see that women are much more disadvantaged than men across all countries. So to conclude, I'll mention some conclusions of our study and the policy implications. So we saw that rural women are significantly more food insecure than men in all the three countries. This points out to possible gender-biased discrimination, inadequate access to food. And the prevalence of severe food insecurity is also higher for them, but only in Tajikistan the difference was statistically significant. So the food security of rural women has been disproportionately affected by COVID-19. So what are the possible drivers? So some of the possible drivers we saw in Roman's presentation earlier. So and we need to do some more work to explore those drivers. So the results that we got from this methodology should be linked with some of the indicators that Roman mentioned, some regression techniques, to see what exactly leads to these changes. Because we believe that, of course, there are pre-existing inequalities and limiting social conditions. So the gender gap, the gender differences were existing even before COVID. We need to see how much of this is due to COVID. So women are more exposed to irregular informal sector, and they are more exposed to low-paid seasonal agricultural work or unpaid farming. So they may report higher income losses and disruption of jobs and business and perpetuated gender-based gaps in the labor market. And as Roman said, they have also limited personal skills and limited access to credit. So all this is to say that in terms of policy implication, we need to establish measures to reduce gender inequalities in food security and nutrition. This needs to recognize the specific roles that women have in the food system as food producers, processors, and as well in household nutrition. Of course, the strategy should include both short-term assistance and livelihood support in the long term. As you know, food security is multidimensional. So let's say the measures that we need to put in place from gender-sensitive social protection to ensure also equitable access to productive resources, inputs, and services, financial markets, as you've seen, and also support rural women's economic activities. Spasibo.
Thank you.
Back to you, Susan and Roman.
Thank you very much for that excellent presentation. Very good teamwork between the two of you, and for sharing with us the results from the FIES study. Over to you, Roman.
Thank you very much. Our next presenter is, as I said, Mary Kangasniemi, representing FAO, with a paper on Cash Plus pilot study in Kyrgyzstan and Armenia. Mary, over to you, please.
Thank you very much. Good afternoon, everyone. Thank you for this opportunity. And let me try to share my screen to show you the presentation. Can you see it? So thank you. I want to highlight at first, well, Roman already mentioned that we have presented some results 2 years ago, I believe. And we had a similar pilot in both Kyrgyzstan and Armenia. So this is somewhat broader in scope. We talk about both pilots, plus we do have some results regarding gender and also COVID, which of course were not part of the previous talks so much, if anybody remembers that. And I want to highlight the fact that even though I am the speaker, I have very much collaborated in putting together this presentation with colleagues Zaruhi Beglarian and Susanna Karapetyan from FAO Armenia, and Mauricio Rosales and Svetlana Livines from the headquarters, FAO headquarters, who were coordinating this overall project within which the pilots were carried out. And some of them, I hope, are also in the virtual conference room. So at the end, if there's time for questions for this session, you know, they might be also able to respond some questions in addition to me. And first, let me start by saying, what is Cash Plus? In case somebody has not heard of this type of intervention before. It's a way of a social protection intervention where cash transfers are combined with livelihoods or productive elements to vulnerable households, plus can also include various skills on knowledge building, training, services and components. And I've seen from the picture here, there's cash, which is meant to address or addresses the basic needs, protects assets in the sense that this regular stream of cash prevents negative coping mechanisms, for example, like selling your assets or savings prevents taking loans, and generally provides that income security that allows households to plan for the future and manage their risks first and foremost. And plus then inputs, which are to support their livelihoods, to increase income generation, economic inclusion, we could say, and trainings to give the skills to be able to use those inputs. And need to highlight also that it's an important tool that can be used for nutrition sensitive social protection, especially in the context like in these pilots, where the productive components concern agriculture or production of food. There are various channels through which nutrition and diets can be improved through this type of interventions. First of all, obviously, through both cash transfers and income generation, the households have more funds to purchase food. then they produce food themselves and consume that, which in case that food is kind of responding to the possible gaps in their diets, it's a very important route as well. Locally, if there are enough people who then produce more food with the help of this type of intervention, there's increased availability and prices might also be reduced locally, helping also then those families who are not actually receiving directly this intervention. Talking about gender issues, and I guess also other intersectionalities and age, hypothetically, this type of intervention could help with intra-household distribution of resources and food towards more equitable direction. And then the last but not least is that often also in these two pilots, the skills training or that element includes specific nutrition education to help them to guide that additional consumption to healthier direction. And just to quickly tell you about what these two pilots were all about, they were implemented by FAO within the project, developing capacity for strengthening food security and nutrition in selected countries of the Caucasus and Central Asia. And the financial support came from the Russian Federation. In both countries, there were partnerships with national ministries. In Armenia, Ministries of Health, Agriculture, Labor and Social Affairs, and in Kyrgyzstan, Ministry of Labor and Social Development, and then of Agriculture, Food Industry and Melioration. And the aim here was take a national cash transfer social assistance scheme, which already is like targeted at vulnerable households and provides that regular income stream, and then to choose a set of beneficiaries who were then provided that extra productive support plus all the other elements of the this mainly the training and skills and coaching components of these pilots. Obviously, the pilots were small, but the aim is really to demonstrate how this sort of support can be used and what it can potentially do. Plus, of course, also learn any lessons that there might be for future scale up of similar interventions. Now, obviously, talking about agriculture, we need to, of course, acknowledge that a certain type of production that works in a specific region might not work elsewhere. So, of course, there has to be that idea that it's an adapted to each region or locality specifically. And, you know, not to forget that it's not just, the idea was not just to carry out these small projects, but also engage sort of in the wider discussion of social protection and how it should be done and could be done. And also to use whatever was there, the existing structures. In this instance, social workers, local authorities who already work in the region but may have limited resources to do things to sort of build their capacities and they know the regions best. So, you know, you have to use that to be able to implement them as well as possible. And what did the pilots involve? Like I said, they were in both countries, there were national social assistance schemes, which were used as like sort of basis for selecting the beneficiaries and then sort of looking into what type of support these households might need and providing that. The pilots were about the same size. It sounds little, 150, 133 households, but actually the number of people who benefited in each was over 800. So it was of much more people than households, I would say. The social assistance schemes themselves already have a certain eligibility criteria. Households are measured to be vulnerable by certain criteria, and then on the top of that, because these interventions effectively require you to have land. There was that additional requirement. And then in Kyrgyzstan, the actual productive package was crops and the greenhouse for crops that were selected so that they provided like this that nutritional, I would say, it provide additional very nutritious food that the households could consume themselves or sell. There were different packages with different size of perceived potential for income generation vis-a-vis auto consumption. And the households were told about how the sort of labor requirements of this taking up the package, and they could sort of self-select into the program. Whereas in Armenia, there were two different packages. One was the cow, which of course requires a bit more capacity. So for those who took the cow, there were additional criteria, meaning they have a barn where they can keep it. But then also those households who didn't that capacity, a different package was provided, which was poultry and raspberries. Raspberries in this instance are something that over a few years could potentially be generating cash income for those households. In both pilots, there were of course the trainings. It's absolutely essential. Of course, you want to know they know what to do with them. Surrounding agronomy technology, and the mentioned nutrition education, plus involvement of local social workers, and the beneficiaries were also followed up. These were like the sort of micro level project definitions, whereas at the national level there was also that involvement in the sort of national discussion on social policies. In Kyrgyzstan, I have to mention, there was also, as a part of this nutrition element, there was a cookbook which put together traditional recipes which were sort of acceptable for the population, making use of those crops that they were growing. And I have to say, in our process evaluation, the local beneficiaries actually acknowledged this cookbook very strongly, that it was extremely useful for them. Then, of course, we wanted to know what were the results of the project. We carried out actually quite a few different assessments, microsimulation before the pilots were ever finished, to check in a national level data what could be the impact of projects of this, providing this level of support on poverty, plus also food consumption, because these household data sets include some information on consumption of food of this type of households, or all households, but we could narrow it down to the family, the social assistant clients. Rapid assessments, which were meant to be like sort of micro impact evaluations. Basically, we did the best we could, given the resources and the size of the pilots, to get at least some sort of hard quant evidence of what happened, what was the impact. They were not full-blown impact evaluations, obviously, but trying to mimic that sort of setup with the comparison group and the beneficiaries. In Armenia, also COVID hit. Okay, the pilot was already over. These pilots basically took place around 2018, 2019, the actual activities. The pilot was already over, but said, okay, we want to see if there has been any impact on resilience of these households. So a follow-up phone survey was carried out to check how they were going. The questions were many similar questions to what you had in the pieces of research that were just described, because these were part of the FAO recommended or suggested sets of questionnaires that could be used for COVID impacts. And in Kyrgyzstan, there was a consultant or two actually who did a in-depth process evaluation, basically going through the process of the whole pilot and looking into things like efficiency, sustainability, relevance, and the institutional, how it works at the institutional level. We looked at things like food security, dietary diversity, income, livelihoods, of course, the main target of the project, one of the main targets. inclusion, subjective poverty, and what they still see as barriers to really expanding the production to a level where they are not anymore poor. And also women's empowerment and decision making, a sort of standard set of questions on who makes the decisions on so and so and so in the household. And like I said, in the COVID follow-up, it was very much of the sort of the FAO idea of how our agricultural activities and sort of livelihoods in general impacted by COVID. And going to the results, I'm just sort of really trying to summarize, I mean, the length of the presentation. We have a huge amount of material. Length is limited, but just to sort of to go to the very basics. In both countries, it does seem that the pilots did change something. I mean, there were positive trends in, you know, feeling more comfortable about food. I mean, these are things that came out in both quantitative rapid assessment and then the accompanied qualitative one. That they felt that they had more, you know, confidence in food security, and they were consuming more of those nutritious items that had been missing, also for children and women. And there were relative improvements in income generated from on-farm activities and also sales. But I have to say that sales was not, especially in case of Kyrgyzstan, they did sell some, but it mainly came like through self-consumption. Or maybe then that released funds from other sources to be spent on other things. But this was sort of maybe the sort of weaker part of it, that they didn't start selling large amounts of these vegetables. In Armenia, there was a really bad agricultural year. So, but the results, however, show that these households coped somewhat better than others in terms of income generation and agricultural activities. In Kyrgyzstan, they do say that they feel less poor, even if not a complete exit from poverty has taken place. And in Armenia, the COVID survey did show that they seem to have higher dietary diversity than the others after the pandemic had already started, whereas others may have been already suffering. And they seem to have a slightly more positive outlook to what's going to happen to their incomes. As far as gender is concerned, I mean, there's cash transfers alone, which are widely studied, are often hypothesized to make big difference for women. And they do, as we know from evidence, they do improve, like in the same way as for any household or any person, they enhance these economic productive activities for women as well as men. But it's not equally well known whether they sort of, in a deeper sense, change the or make women more empowered, at least not without other elements that would help that sort of change. Okay, cash plus, depending on how, of course, it's done and what are the activities and who are they targeted at, it could be maybe stronger in this respect. I don't think it's like something that would be, it would be sort of overall evidence that sort of shows that this is always the case. These pilots did not have a particularly strong gender focus, but however, we don't want to diminish that. I mean, these sort of activities, kitchen gardening, livestock, or anything to do with food and nutrition, they can, I mean, they're often from the start, I mean, it's something that women in the household are doing. So it could have changed. However, I mean, the rapid assessments show that there were no massive changes in intra-household decision making. Nothing that we could say that strongly points to sort of big change having taken place there, which is maybe a lesson for everybody to learn, that, you know, again, in a project, especially if you want to get something like that as a result, you know, it should be a sort of integral part of the whole intervention. And now, just to go to the conclusions, summary, 2 minutes from what I just said. Okay, the positive results. Also, I mean, there were barriers remaining that came out, like, you know, didn't completely solve the issues with access to inputs market or credit, or sort of the fact that locally income and prices can be very uncertain. I mean, obviously, it's always well acknowledged that these social assistance schemes already help a bit with that, though they neither resolve these things. Like I said, you know, if it was to scale up, of course, what the productive intervention is would depend on the local conditions, and especially for gender. If we want gender transformative effects, we might want to sort of start from a really strong gender perspective and do something more than just provide the productive support. I have to say that they did contribute to national policies and policy dialogue. They were acknowledged, and in Armenia, I believe there was a government-led pilot along the same ideas. And in Kyrgyzstan, there were these policy processes, so several-year programs, and that were being drafted, and the Cash Plus experience definitely contributed to those processes. So I think I've done my 15 minutes, now even more. I'll stop here. Thank you, everyone. I hope you found this interesting. And I hand over back to Susan. Thanks.
Thank you very much, Mary, for the very interesting presentation. In order to save very scarce time, let us proceed immediately with the next presentation of Gulnora. Gulnora, over to you.
Thank you so much, Roman. Good morning, good afternoon, and good evening to all the participants who joined today's Life in Kyrgyzstan conference. So my name is Gulnora Mukhamadieva. I'm a global lead for gender equality with Aga Khan Foundation. And in the next 10 to 15 minutes, I would like to share some key findings of the rapid gender assessment that we conducted last summer. So this assessment was part of our new partnership between the government of Canada and Aga Khan Foundation. And the new program covers 5 countries in Asia. It's Afghanistan, Pakistan, India, Kyrgyzstan, Tajikistan. And the huge program, 5-year duration, is focused on strengthening the access to health services, early childhood development, and also advancing gender equality through civil society. So the key focus of this program is to support the countries in this region to improve the health and well-being of women, girls, their families and communities. And the project is taking a life cycle approach. So basically from early childhood through the adolescence to adulthood. And the project also will work at the intersection of systems for healthcare, ECD, women's empowerment, and gender equality. And we have one big separate component called Advancing Gender Through Civil Society, where we will be partnering, or we already started partnership with the University of Central Asia and through the Civil Society Initiative. So we are establishing School for Advancement of Gender Equality, where we would really like to support the civil society actors and make them more kind of engaged in the whole processes and the implementation of gender equality programs. And as part of one of the requirements for many of the programs funded by the government of Canada, we had to conduct rapid gender assessment for this program. So usually we have up to 6 months to look at to conduct the consultation and conduct this rapid gender assessment. And the key objectives of this assessment, it took place last summer from June up to September in all 5 countries. But today I will focus only on Tajikistan and Kyrgyzstan findings. And the objectives were to document and provide insights on key gender inequality issues across these 5 countries, to identify gender roles and responsibilities and capacities and vulnerabilities. And also because we had this assessment in the midst of the pandemic, it was really important for us to understand what is the impact of COVID-19 on women and girls. And once we conducted this rapid gender assessment, the results and findings are usually used for the development of the project level gender equality strategy and the implementation action plans. So the methodology was, because of all the limitation we had with this assessment, we had an international consultant who was leading it and conducted a comprehensive document review and looked at the available data and learnings and also conducted consultation and focus group discussions in each country, including healthcare providers, gender equality focus organizations, representatives of national and local governments, and of course, women and adolescent girls as well. And when doing this gender assessment, we looked at the frameworks that we usually use across many Aga Khan funded implemented programs. So we look at the areas of interest in terms of the laws and policies. So what are the frameworks existing in each of the countries in terms of the providing equal opportunities for men and women. Then we look at access and control and belief and practices, decision making. We looked also separately at the services, institutions and programs because it's a 5-year program. For us, it was really important to understand who is else working in these sectors and how we can complement each other. And of course, as I said, we looked at COVID issues and responses. This is the structure of the report. I won't go into detail. And this is also the key areas of interest that I just mentioned. So starting quickly with the Kyrgyzstan findings. And as I said, this is a 5-year program. And for us, it was really important to understand what are the laws and policies in all of the 5 countries. So in terms of the, and the focus was on health and ECD. So the constitution in Kyrgyz Republic provides equal access to health services, both for men and women. There is a law on reproductive rights also, which covers the issues of women's rights to reproductive choice, contraception, safe pregnancy, and access to abortion. There is a national HIV policy, which also has a kind of provisions in terms of providing condoms for STI and HIV protection. There is a legal framework on domestic violence and family protection, but unfortunately we find out that there are issues with its implementation, with the funding, etc. And the spousal rape is a criminal offense in Kyrgyzstan. We have seen the cases of early marriages in all of these countries, and in Kyrgyzstan, early marriage is criminalized, and marriage is allowed at the age of 17 with judicial permission. There is an ECD strategy in Kyrgyzstan, which also has a great focus on expanding the preschool education, especially looking at the rural and the urban divide and making these services more accessible. In terms of the access and control, the findings of the rapid gender assessment shows that men typically own large assets and a few women have financial accounts. And today we heard in all the presentation, in terms of the men basically managing the assets. We saw that there is concerns about declining access to SRHR services, and we did see urban and rural disparities. During the COVID, it was even more striking that to what extent this region has really limited available mental health services. And during the COVID, we saw a very sharp increase of mental health issues, both for men and women, children. I'll go into more details later. We did see rural and urban divide in terms of the accessibility of the ECD services and the space and limited resources. And I have to say that in Kyrgyzstan, the recent in the last 5 to 6 years, there has been major reforms and there is a focus now on rural ECD services. In terms of access to health services, we find out that adolescents and unmarried women shy away from seeking health services. So it's linked to the cultural and traditional issues. So unfortunately, they don't tend to more proactively seek health services before marriage. And one of the respondents during rapid gender assessment mentions that access to these services as well as information is still an issue in many rural areas. So many women and men in remote areas never get regular medical checkups, and sometimes they find out about their disease only when they're pregnant and when the prenatal checkups are mandatory and they have to do it regularly. So in terms of the practice, beliefs and practices, the rapid gender assessment results shows that men have authority over women's and girls' right to access health and education services. Women and girls' hygiene and menstrual health management are taboo issues, unfortunately, still in these countries. And we see 6.3% of women having kind of child bearing between the age of 15 and 19, although by legislation, it's not allowed to marry before the age of 17. Unmet needs for family planning services, it's around 18% in Kyrgyzstan. And the next big issue is the education, the sexual and reproductive health rights. Education is taboo, and sexual health considered women's issues, and men and boys have very limited information about this. Conducting any comprehensive sexuality education is a bit sensitive topic, and it's not very kind of highly, and schools don't do it very kind of with a high enthusiasm. And we did see increase on gender-based violence across the region, and Kyrgyzstan is not an exclusion. 26.6% of women have experienced physical or intimate partner violence. So in the case of Kyrgyzstan, we do know that bride abduction and child marriage exist also, which is often linked to the poverty, to the difficult livelihood and conflict. And the findings also show that the very lack of awareness and understanding on mental health issues and available resources. And here you can see a couple of quotes from our focus group discussions on the left side of the screen. When it came to the domain around decision-making and participation, we see that across the region, men are taking decision-making seen as a male role, with a female participation on women's health and decision-making in marriage, although it is changing slightly. And only 31.2% of women reported that they make decisions about their own health. And again, there is disparities and differences between the rural and urban differences in decision making. We looked also at the percentage of women at the parliament, and in Kyrgyzstan it's 19.2. Members of parliament are female, and 9.5% of parliamentary ministerial level positions are occupied by women. Again, it's quite low indicator for the region. Due to the increased kind of, and in general, the household responsibilities and childcare responsibilities and looking after elderly members of the population, we do see very limited kind of engagement of women in the community activities, and also limited acceptance. You know, it's really very difficult and sensitive for women to be actively engaged at the community level activities.
I'm very sorry. We are at risk to be terminated mechanically because the session comes to its end. So can you please proceed to your conclusions? It was very interesting.
This is the COVID responses. So basically on Kyrgyzstan only. So we see very high number of females called for the gender-based, I mean, there were cases increased reportedly by 65%. We did see increase in teen suicide rates. Unfortunately, in Kyrgyzstan, it has been reported. And and all in all, it has been quite challenging period, basically, with very limited access to the services provided to the victims of gender-based violence. Lots of mental health issues, etc. So I'll stop now. Sorry for rushing.
Thank you very, very much. That's a really fascinating presentation. We have the your presentation, and eventually it will be shared with all the conference participants so they can find data on Tajikistan there. We received so far 2 questions from Tilman Brook, and I believe we can provide at least one answer. Erdgin, could you please respond to his question, and I will respond in some other way if time allows. Thank you.
First of all, thank you, Titelman, for your question, and nice to meet you here after probably 4 years where you worked for SOFI 17. So yes, I mean your question is very pertinent. So you're asking whether we could go beyond asking people on COVID, and indeed, let's say our perception is that while we test the FIES related questions through item response theory, we are not able to test the COVID follow-up question. So, and the overall perception is that the people tend to over-respond, to over-attribute to COVID their food insecurity experiences. So, but in order to go more in depth, you're talking about causal link. I don't know if, I mean, with the cross-section, be able to provide a causal link. Definitely, we could do more in triangulating and saying, through regressions, what are the drivers of that? Why they attribute this, let's say, to COVID their food insecurity? We would like to link with the other questions. So loss of income, lack of access to markets. So basically, through regular techniques, we would like to see what are the drivers of their positive, and what part of that response could be explained by other COVID-related questions that left. So yes, my question, we would like to go more in depth. We also would like to think how, let's say, COVID-related questions like the ones that I mentioned have also affected the food security. So without considering the follow-up question, but what are the COVID-related questions that affect the current food security people? Of course, this is a cross-section, and we don't have a panel data so we don't know how much is pre-existing inequities and how much is driven by COVID. But we can say, at least we can tell something more about that. Thanks a lot for your question.
Thank you. Well, maybe I will still have 30 seconds to answer Tilman's question, which he asked how to separate the general recommendations on gender equality, which are relevant even regardless of pandemic, and those specific for COVID-19. So the short answer, basically, that's similar recommendations, but some things which we knew now look much more acute and much demanding more attention, like, for example, building targeted social assistance schemes. Well, we knew it is important, but now we really feel that there are vulnerable rural groups lacking that. For example, shelters for women is a very well-known story for urban areas. Now we understand it's an issue for rural areas too. Thank you. Over to you, Susan.
So thank you very much. That was, and I'm really apologize that we didn't have time for questions because those presentations were extremely rich and provided a lot of very, very useful information. I want to thank you all for the excellent presentations, and we really will be sharing the presentations with all the participants. And I think we've all had a really good session, and we learned a lot. Thank you very much.